To prevent an ongoing crisis, we must do three things urgently. First, we must maximize our healthcare capacity. Secondly, reduce transmission of the virus by reducing interaction with other people. And thirdly, we have to get as many people as possible vaccinated. On healthcare capacity, our frontline workers are doing incredibly heroic work. After 19 months of COVID, many of them are completely exhausted, and understandably. Alberta Health Services is doing everything possible to staff more beds for the growing number of COVID patients. Dr. Verna Yu will have more to say about that in a moment, but there are still real limits. Let me put this in context for you. Even with the biggest per capita healthcare budget in Canada, Alberta hospitals normally, outside of a COVID year, have a total of 173 staffed intensive care beds, and we usually operate at about 85% of capacity. But as of today, we have 269 ICU patients. We've made the difficult decision to postpone thousands of surgeries and other procedures to free up staff and resources for COVID patients. And we're sparing no expense to expand capacity. But unless we slow transmission, particularly amongst unvaccinated Albertans, we simply will not be able to provide adequate care to everyone who gets sick based on current trends. Which brings me to the second urgent priority, which is increasing vaccination rates. This is a crisis of the unvaccinated. 90% of our intensive care patients are unvaccinated. And if you are between the ages of 20 and 50, you are 50 to 60 times more likely to be hospitalized with COVID than if you are vaccinated. So I do not say this, by the way, to stigmatize people, but we all need to understand that the decision not to get vaccinated is not just a personal choice. It has real consequences for our whole society and for the ability of our hospitals to cope. COVID is hitting Alberta harder than anywhere in Canada because we have the lowest rate of vaccination in Canada. This is despite 9 months of educating people about the safety and effectiveness of the vaccines, despite making it as convenient as possible to get the jab in every corner of the province, including 1,400 pharmacies, and despite Alberta having the most generous incentives in the country, from $1 million lottery prizes to $100 gift cards to those who get vaccinated. I want to thank the nearly 80% of adult Albertans who have stepped up to protect themselves, their loved ones, and our healthcare system and its workers. But it has now become clear that to save lives and prevent business closures, we must go further in encouraging vaccination and reducing the chance of infection for those who are unprotected. That is why the government has reluctantly decided to adopt the Restriction Exemption Program, a proof of vaccination program for participation in certain discretionary activities that have a higher risk of viral transmission. No one will be compelled to get vaccinated against their wishes, and a negative test option will be offered as an alternative. But with unvaccinated patients overwhelming our hospitals, this is now the only responsible choice that we have. I had earlier committed not to introduce proof of vaccination because of concerns I had around privacy rights. But the government's first obligation must be to avoid large numbers of preventable deaths. We must deal with the reality that we are facing. We cannot wish it away. Morally, ethically, and legally, the protection of life must be our paramount concern. I believe that the vast majority of Albertans understand this and support this. Our third key goal is to reduce viral transmission. If we fail to do so, the pressure on our hospitals will be unsustainable for weeks to come. So this is truly a life and death matter. That is why the government has authorized a series of new public health measures, such as capacity limits, limits on indoor socializing, requiring people to work from home whenever possible, physical distancing, and more that will be detailed by the Minister of Health in a moment. We have sought to minimize the impact of new health measures on children, recognizing that they have suffered disproportionately throughout the last 19 months, even though they are at the lowest risk of severe COVID outcomes. We'll also avoid business closures by allowing hospitality and other businesses to participate in the new proof of vaccination program as an alternative. This means that businesses can operate safely while cutting viral transmission at the same time. I know that we had all hoped this summer that we could put COVID behind us once and for all. That was certainly my hope, and I said so very clearly. Based on our analysis of other jurisdictions around the world with similar rates of vaccination, we believed that we could prudently move away from addressing COVID as a pandemic and towards an endemic. It is now clear that we were wrong, and for that, I apologize. Jurisdictions all around the world have been learning how to deal with this ever-changing threat to human life. Often that has been a process of trial and error. I know that we all want certainty and predictability during these difficult times. But one thing we've learned about COVID is that it simply is not predictable. We must address the challenge as it emerges, seeking as we have from the beginning to protect both lives and livelihoods. We've all seen the increasingly divisive debate about how to address the challenge of COVID. But whatever your views, I ask that you try to find some common ground with your fellow Albertans. Please give a thought or a prayer for the hundreds of COVID patients in our hospitals right now, many of them fighting for their lives. Please find some way of showing gratitude to our amazing frontline healthcare workers who are coping with unimaginable stress. Please show patience for people who have different views than yours. And please do your part to save lives and protect our hospitals by staying at home when you can, limiting contact with other people, and protecting yourself with the vaccine if you have not yet done so.